Ocular syphilis can cause irreversible vision loss, but with a high index of suspicion and early treatment with aqueous penicillin, you can save your patient's vision. This is a case of a young man with ocular and neurosyphilis and newly diagnosed HIV. He's a 36-year-old man who has sex with men, and he's never been on PrEP. He presented with subacute malaise, weight loss, and a non-itchy rash. In his right eye, he was also complaining of blurry vision with some floaters and peripheral vision loss. On exam, he was cachectic, had an erythematous macular rash all over his body, including his palms, and in his right eye he had a temporal visual field deficit and could only make out the largest letter E on a Snellen chart. His RPR was very elevated at 1 to 1,024. He had about 46,000 copies of HIV virus per milliliter, and his CD4 cells were just above 200. His CSF was notable for 15 white blood cells and a negative VDRL. At this point, he was consistent with new diagnoses of HIV, secondary syphilis, and neurosyphilis. On ophthalmic exam, he was found to have a panuveitis, retinitis, and vitritis. All of this was consistent with ocular syphilis. In fact, he had retinal angiography, which demonstrated syphilitic retinitis with occlusive vasculitis. You can see the contrast in this vessel going all the way out to the periphery of the eye, but in this section he's got a complete occlusion of contrast right about there, and that leads to some retinal ischemia and can contribute to irreversible vision loss. In his case, he was treated with aqueous penicillin G on a 14-day infusion. He then took bictegravir, tenofovir alafenamide, and intracytidine. Right after being treated with penicillin, he had resolution of the rash and some partial but not complete visual recovery. His RPR responded with greater than fourfold decrease, and after 4 weeks on ART, his viral load was down to less than 300 copies, and his CD4s were above 400. This case demonstrates several learning points. First, about risk factors for ocular syphilis. In a case control series in Vancouver, British Columbia, several risk factors for ocular syphilis were identified, and this patient actually met all of them. So first off, he had a detectable HIV PCR. He also had early syphilis rather than late syphilis, in his case secondary syphilis. And finally, he had a very high RPR titer. He also illustrates some learning points about the diagnosis of neurosyphilis. You'll notice he had a negative VDRL, but this is a rather insensitive finding. In fact, pleocytosis and elevated protein are the more sensitive findings for making the diagnosis. In this patient's case, his delayed presentation is what contributed to his partially irreversible vision loss. But if patients present sooner and you maintain a high degree of suspicion, especially if they have the appropriate risk factors, you can save their vision by initiating aqueous penicillin early in the course.